There are a lot of things we do not know. Actually, the only thing that we know is that humans can give pets COVID. But then you do not know whether other members of the household had been infected and by the same cat. So, or dog, or whatever furry pet that they own for your time.
So Jim Kiambi is next, then Jesse.
Nutrition in relation to disease prevention and control. For me, I believe good nutrition, or rather, if you have a good diet with you, your immune system will be able to fight diseases. Get this. Yeah, you get that when you are infected by maybe flu, it becomes so stubborn to you. The diet, any diet schedule, anyone with a diet schedule, whereby you know you're supposed to take this amount of food, maybe this number of times a day or a week. The other foods, we're supposed to be taking them in plenty. Yes, you're supposed to be taking them in plenty, yes, but do you know what it contains? Do you know what it has? Do you know you can die out of overnutrition? You get a lot of calcium in your body, you can succumb to that, or just bring other diseases or any other conditions that we have. Let me continue. I had a graph. You can see the graph about the food access, the prices of food in Kenya, and the one that's below it, it's about how people are spending on hospitals. As you can see, the food prices are rising, and also the expenditure per capita of everyone in the hospitals is rising. Why? This is because when the food prices rise, you mean that most people cannot access quality food. Yes, some can access, others, your body could fight by its own. But now, because your immune system is not that strong, that's why you get people are spending more on hospitals. Another risk that is coming with that is that when you subject your body to a lot of medicine by going to the hospitals, because you'll be prescribed, given medicine, it also means your body will adapt to, the immune system will adapt to the medicines, meaning that even if you're coming to get any infection that will be around, your body cannot fight it well. There must be something to help it, to boost it. That's why you're hearing some people are getting the COVID vaccines, yes, but you still get a reinfection and all that. The other thing is, even when the trend continues like that, you can see the graph is giving a prediction. If the government should chip in terms of food provision, make sure that everyone can afford quality food, and we will be able to fight this as a country. And most of the diseases that...
Let me use the microphone. So I want to begin by demystifying the myth that Professor Nguru shared about people from her region, that malaria can be transmitted by mangoes. That's very, very false. To put it into the right scientific evidence, I want to say that malaria is transmitted by infected female Anopheles mosquitoes. Now, I want to first of all remind us that since the work of COVID-19, research on malaria has been scaled down. This is partly due to lack of enough funds. Residents of Homa Bay County remain at risk of contracting malaria. Factors of malaria endemicity in Homa Bay, already established malaria measures, preventive measures in Homa Bay County, and to establish the public knowledge and usage of the established malaria preventive measures. My justification is that it is hard to stabilize economies and populations in developing parts of the world with people at risk of such a debilitating disease. The study is expected to take an experimental. Tests will be applied if absolutely necessary, because they can help us to collected will be cleaned, coded, and categorized. Thereafter, it will be analyzed using statistical package for social sciences. Index shows that 27% of children to 1 to 5 years living in the area within the Lake region basin are at higher risks. My results show that malaria incidence and prevalence in children under 5 years old in the country is increasing from 2000 in Homa Bay County. This will help to elucidate more on the morbidity and mortality rates. Thank you.
Nicole?
Presentation. So what is sewage? Sewage is basically wastewater this particular sewage systems can come into contact with domestic water, which will definitely affect the population that is living around that area. So what are the definitely have a mass health education program for the people living around that area. How will we conduct this study, and why is this study important? Majority of the slum areas in Nairobi County are densely populated. Looking at numbers around 250,000, 80,000, and 70,000, depending on the type of slum in Nairobi. So at the beginning, yes, if you look at that photo, this child, okay, I'm assuming it's a child, if this man is hopping over open sewage that it doesn't look so nice, right? It looks very. According to results that I've gotten from previous studies, we will look at, found out that a cholera outbreak actually stemmed from samples that were collected from an open sewage system around the area that these people were living. For your time.
Charlene Muloma. Charlene Muloma, 5 minutes.
All protocols observed. Good afternoon. My name is Shelin Muloma. I am a fourth-year biomedical science student, and I will be discussing on the evaluation of sustainability of sanitation interventions in Rangwe village here in Kenya, Homa Bay County. Globally, 3.6 billion people lack access to proper sanitation, and to bring these statistics closer home, here in Kenya we rank amongst the top 26 countries globally that still practices open defecation. In Homa Bay County, 1 out of 3 people lack access to proper sanitation since stunted growth, and this is attributed to inadequate sanitation facilities. An interesting factor about this village is that in Rangwe, it was declared 100% open defecation free, but currently they have not been able to sustain the sanitation interventions there. So what are the constraints that are hindering the sustainability? By monitoring the sanitation coverage on a monthly basis will occur to see if these community members are upholding the implemented activities. Then there will also be mobilizing of the communities for educational campaigns and also creating awareness in children, especially in schools, and teaching them on the water, sanitation, and hygienic practices. Carrying out sanitation marketing, creating village saving groups, which will provide finances for maintenance of these facilities, and it will also enable the community by the use of ash instead of soap. And lastly, train local masons and on the proper construction of flood-resistant toilets. So my expected outcomes for the first 6 months, we expect to see an increase in the accessibility and acceptability of well-constructed toilets. Second of all, reduced number of waterborne diseases burdens will also occur, and a health care seeking behavior will also be low shows a breakdown of a decrease in waterborne diseases due to proper sanitation. Then health benefits will also be able to improve, and a total of at least 30 local artisans will be trained on a weekly basis on the construction of affordable, long-lasting latrines. And last but not least, the saving groups that will be implemented will be able to provide loan schemes for this construction and the maintenance of the facilities in increasing the demand of sanitation services. In light of the results of my study, communities which leads to their regressive behavior, the pie chart illustrates a projected improvement of sanitation coverage, and with continued efforts, the county will be able to achieve sustainable open defecation-free status. To draw my presentation to a conclusion, implementation of sanitation activity run. Hence, we have to input stringent measures, and together with the combined efforts of major stakeholders and the community at large being part of these follow-up activities, we will be able to achieve the ultimate goal of Sustainable Development Goal 6. Thank you so much.
Sorry to interrupt with this very meaningful discussion. I want to thank, first of all, Dr. Monica Opio and your class for just doing what you're doing, lifting Daystar up. And so I'm very proud of you. I would also like to recognize our guests from the University of Maryland, Professor me, Dr. B. It's quite a name. Sister Lando, the Director of Research, but also my Dean, Professor Martha Carrier, fellow faculty who are here, and my students. I am extremely delighted, and you know me, I'm very careful with my words. So when I say I'm extremely delighted, I mean it. I'm not flattering anybody. There are people who do a BSc honors, and then they go and do a PhD straight. They don't have to do a master's. So we are beginning to feel courageous as I listen to many of you that you can actually become if we support you. She's the one who's doing the evaluation. Last night, they're actually staying at my house. She was working very late on these papers. Comments, very broad comments. I'm not going to zero in. So I'm very impressed with the mind formation towards research. That's a big step, and you're doing a fantastic job. No wonder last year you were nominated as the best lecturer in the university. You can see the products that she's producing. Secondly, even me myself, I don't know if this is by coincidence. Martha was telling me, I don't know, is it coincidence? I don't know where, but and this is my field. However, I am a little worried with the grounding that you need to acquire in understanding the language of research. The language of research. In other words, there is a language register that people in research use. And I saw the word justification coming out of your situation, and you want to do that study. Justification. So why? And that's why we're getting into problem-based learning. That's why these concepts like justification, them in the groups, and they go and research from different what the term justification means. And once you understand it very well, you then align it, you then use it appropriately in your study. So I noticed that, but then I'm not condemning anybody, I'm just saying, but wow, when I was doing my undergraduate, I didn't know what justification was. You know, I submit at Kenyatta University, I had no idea, what is this? And here you are confidently using the word. Just remember, when you tell us about justification, somebody sitting somewhere would want to hear the significance. So as you talk about justification, I want you to tell me the importance. Why you are doing the study and why is it important, the significance of that study. So please look into that area. Methodology. And again, I understand you are undergraduates, but we are not going to, you know I can teach calculus to a class 3 student. I can walk into a standard grade 3 student in a primary school and teach them calculus. I can walk into a class 6 and teach them the working of the heart. So we want you to get it right now. Don't say, I am an undergraduate, then when I'll go for masters is when I'll clean out this. Why don't you clean them now? And I think, Madam Dr. Opio, you are doing a fantastic job. But we need to sharpen them. We need to really, really sharpen these students. And who knows, with the global collaboration, global health collaboration, and my vision of this university, I would like to see many of you push yourself to the global space and compete. Yes, and you can. So can we get these concepts very clearly? Maybe, again, through my Dean of Science and Opio, maybe we should have a symposium. I was just thinking, why don't we have a symposium? You invite all of us in the area of research, and we just throw ideas. I do a presentation on literature review. I am a methodology person, chapter 3. I go through these concepts, all these concepts. What are methods? What is validity? What is reliability? And even what is sampling? Just a seminar. It would be interesting if we assembled, and not just these students, but undergraduates. And this hall is big enough, and they can ask their questions, and we send them into groups. That would be very interesting to get them more focused in the area of research. Finally, there's something called APA. Is it the American Psychological, what? Association, 7th edition. Is it 7th now? Yeah, 7th edition. I love those pie charts, but they don't fall under the APA nomenclature. And I want them to get to know that. We want to see your tables, we want to see your graphs, but you know, if you look at APA in terms of data presentation, there are certain conventions, and we want to be like the world. So I saw some very beautiful graphics, but I was asking, are these within the APA? Because we want to be strong, so they must learn from here. So I am a very satisfied Vice Chancellor, I'm a very satisfied father. When I see you come here, really it takes a lot of courage and a lot of work. By the way, this was brought to my house over the weekend, so I also had time to go through. Amazing work done by all of you. So I want to encourage you. Unfortunately, I'll not listen to the remaining 10 or so because of exigencies of duty, but just feel encouraged. And sometimes we use this word. I don't know where we used it yesterday. I don't know whether it's in this class or somewhere. I met a team, small group yesterday. Sometimes, you know, I believe if I start walking from the main campus to my house at Lukenya Getaway, if I walked on that road every day, morning, evening, I'm sure after 6 months, one day I'll pick 1,000 shilling note. Yeah, and you know, I would never have picked that note if I was not walking. So the more you search in an area, the frequency of visiting something, I don't know what it is that you're visiting, something just comes up. And the word I was telling the group yesterday was it is called serendipity, the fortune of encountering good luck on your journeys. But what I've learned in life at my age, I know that many people determine their own destiny and they call it fate. No. I've seen about 4 students, if I wanted to be particular, I made some notes. 4 students whom I would want to see flourish just by their presentation. But they have not reached that level. I know how much they have punished themselves to be able to acquire that. So we are saying this, chance favors the prepared mind. Yeah. You know, I can just decide after this to tell Opio, can you give me 2 students? 2 students. And the next application, we have an open grant, a small grant under the consortium of Christian colleges and universities I was given. So when the Dean School of Nursing will be going, you can decide to pick 1 or 2 of these students. But you'll have to convince me, not because they come from Homa Bay. No. You'll have to bring me their performance, their GPA. So chance will have favored them. And that's what we'd like to do. So please feel encouraged, and this is the day's time I'm looking forward to. Thank you, and God bless you.
Let's everyone stand up. Everybody's got to move a little bit here. So stand up, wiggle around, get some blood flow so we can listen to the next set with attention. There's a monkey there.
Right where we came from, right there on your left.
So I'm going to run out.
Yeah. Anyone who can give us a teaser to make blood circulate, flow. I saw, where is the guy from Homa Bay in a suit? Where is he? Homa Bay, come.
Homa Bay.
Encourage him with your claps as he's coming. Good. Thank you. Do you have a way to make us relax?
Good afternoon. Before we exercise a little bit, let us create a little bit of space between each other because, okay. So maybe you can tap on your neighbor's left and right hand to see if there's enough space so that you don't end up slapping someone on the face. Okay, I believe everyone is well spaced. So maybe the first thing will be to, okay, yes, you know that. Yes, star jump. Okay. I'd want it to be more exciting, so maybe the dean can come and join me. She's energetic. I believe she's energetic. She can dance. So we'll do the star jump. Yeah, with your shoes. Okay. So we'll do it about 7 times. I believe 7 times is a perfect number, and yes, and we'll be ready to go. Okay, and why is Dr. D? Oh, okay. So let's go. Thank you. There's one person who will have to get a penalty, and that is Dr. Monica Opia, because she didn't. Thank you.
Okay, thank you. Let's clap for him, please. Okay, so our next speaker is Duncan Silali, followed by Nicole again, then Egra Savai and Harun Shiundu. And now, please, we will mute the microphone if you go past 5 minutes. Sound, tumesikia. Past 5 tuna mute. Yeah. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Good afternoon.
16.
Good afternoon.
Good afternoon.
You are surprised I'm talking after the VC. I would like to start by answering Dr. Kiare. She asked about the meaning of WASH. So WASH is an acronym that stands for sanitation, WASH starts with water, sanitation, and hygiene. So I will go direct to my poster. And my project is about the impact of hand washing against COVID-19 and other human infection transmission among students at Kamkuya FIM Primary School, Bungoma County. I would like to ask you, how many times have you visited your primary school after finishing? So I would like to put this project so that I can go back to my primary school and teach them about hand washing, the impact of hand washing against infection. These infections that are caused by contact with hands are causing absenteeism in the Kamkuya Primary School. As when I was studying in Kamkuya, that time we had a challenge of hand washing. It was not around. And I guess up to now it's not around. So, and hand washing is a simple thing. It's just the act of cleansing your hands with water and soap to remove dirt, germs, and unwanted material that are stuck on the hands. These germs that are stuck on the hands are microorganisms that can cause contagious human infection, and thus I would like to put this hand washing into project as it is a practice of hand hygiene that prevents cross-contamination and minimizes the spread of human infection caused by these germs. My objectives are to determine if students at Kamkuya FIM Primary School have sufficient access to water and soap to facilitate this hand washing practice. The next objective is to establish how many times these students wash their hands, how they access these hand washing techniques, and how they are used by these students. The last objective is to test the microbial flora that are present on the palms of these students before washing their hands. I will justify this project as it is a study that will be carried out in Kamkua Primary School, because it is a fundamental to the health quality of these students, as it will provide a preventative nature against these human infections that are spread through contact. I'll use the methods as one of them will be field research, where I will collect and analyze data by observing the students' habit of hand hygiene, interact and understand students while they are in school, interviewing lower class teachers and higher classes students. After survey analysis, I will take a swab test for at least 2 students from each class. A laboratory swab test will be before and after this hand washing hygiene. This will show us the impact of washing these hands, as it will reduce the contamination of these germs. There is my results. This graph shows how I'm expecting this project to provide and avail adequate hand washing materials, that is soap and water, to increase compliance of students to wash their hands and keep hand hygiene, thus decline the spread and transmission of COVID-19 and other human infections spread through contact. Discussion and conclusion. I will conclude that effective hand washing is an excellent way of reducing mobility and mortality associated with contact infectious diseases. Therefore, sustained knowledge and practice of effective technique is not useful in preventing COVID-19 pandemic only, but also other deadly infections. I will recommend that this project to be conducted in Kamkua Primary School, as Kamkua has an ineffective rate of preventing transmission of infection that cause potential human infection. This puts them under a serious health concern, as this study will be a useful way of reducing incidence and prevalence of this infection among students at Kamkua Primary School. Thank you.
Thank you very much. Next, Nicole. Thank you. 5 minutes.
Once again. Yes? No, it's a different one. Yes. I hope you're all well. My next presentation is on COVID-19 prevention and its effects on nosocomial infections in public hospitals based in Nairobi. What is a nosocomial infection? Basically, these are hospital-acquired infections. This is actually an area that has not been done, that research has not been done so much in the country, and I feel like it's a very potential area of study. With the country's mandatory COVID-19 prevention practices such as social distancing, hand washing, mask wearing, it is a possibility that the number of nosocomial infections have actually reduced. The overcrowding in public hospitals due to one ailment or another, not one's neighbor aware of what disease another has, to be quite frank, is very alarming, because one person might be coming in with a cold, the other person is coming in with a UTI, and in one way or another, these people are sitting together. If this one is not aware of what infection the other person has, there's a very high possibility or a very high chance that if the immune system of the person next to you is not very high and you cough, this person might actually develop this cough. So very, very many people actually get hospital-acquired infections in our country, and we need to investigate further on this. What are the objectives of the study? To characterize the most common nosocomial infections, to determine the causes of the infection, to establish the interventions and management and treatment of these particular infections, and definitely establishing mass health education nosocomial infections to help reducing the spread of these infections. The rationale of the study, it's very interesting how our country has actually come together in solidarity to reduce the spread of COVID-19. I am very awed by this. Well, in the very beginning times of COVID. But people came together and followed these routine practices. Get out of your house, wear your mask, sanitize, wash your hands. All this was done every single day by people in the country. So this has actually shown us that it is a possibility. It is something that can be followed through. It is something that can be adopted by hospitals in the country and be done to reduce the rate of nosocomial infections in the country. A similar study was done in a different county, and Ukwala sub-county and Ugenya sub-county, in 2012. And with the results, we get to see that the highest nosocomial infection spreading was non-specific fever-associated nosocomial infections, followed by respiratory infections, then UTIs, and others such as blood infections, diarrhea, followed through with the rate of infection, with the rate of spread, sorry. We also get to see the number of people, and based on gender, that got this particular nosocomial infections. And with all this, with the study only being done in one county, with us looking at Nairobi County that has the highest number of population in the country, we will get very many people with nosocomial infections, which increases the need for us to get ways in which we need to reduce the spread of these infections. Hence, as I conclude, there is dire need for more research to be done in this area. The control and management of these infections has been seen very possible through the various methods of COVID-19 preventions that have taken part in the country, and it would therefore be very important to make the first move of reducing morbidity and mortality of Kenyans through nosocomial infections by going through with this study. Thank you very much for your time once again. My name is Nicole. Have a lovely afternoon.
Egra Savai, followed by Harun Shiundu. Michael Kipsoi, are you here? Ah, yeah. You're after Harun Shiundu.
Good afternoon, everyone. I'm Egra Savai, and I'll be taking you through my research proposal. It's about assessing the effectiveness of different coronavirus preventive measures used in Nairobi County. Coronavirus disease, also called COVID-19, is caused by a severe acute respiratory syndrome, coronavirus 2. It is spread through droplets when an infected person coughs, sneezes, contact with contaminated hands, contaminated surfaces or object. Since COVID-19 was announced a pandemic by the World Health Organization, there has been increased rate of COVID-19 infections and deaths as a result of the infection. So this COVID-19 infection has really affected everyone worldwide in terms of education, as there were lockdowns, schools, students were forced to stay at home. The economy was negatively affected as there was low income. People lost their jobs, people lost their lives. So this creates a need for us to conduct a study to see how effective are these public health measures that are put in place in order to control the spread of COVID-19 infection. In Kenya, Nairobi County is the most populated county among other counties in Kenya, and it has the most high COVID-19 rates, leading also in COVID-19 deaths rate. This create a need for us to secure or to take care of those people living in this county and protect them from this COVID-19 infection. As a result, there have been public health preventive measures that have been put in place, such as washing hands, use of mask, physical distancing, and lockdown, so as to protect us from this COVID-19 infection. And the question is, are these preventive measures really effective? This brings us to the objective of the study, which is one, to assess the effectiveness of these COVID-19 preventive measures used in Nairobi County, and two, to assess the impact of COVID-19 preventive measures to people living in Nairobi County. The justification of this study: this COVID-19 has affected everyone, so we need to further investigate the effectiveness of these public health preventive measures, so as to help us curb this disease and protect our people from the effect that come along with COVID-19. And as some effects are really like long term, because COVID-19 virus can affect body organs like the lungs, the heart, and the brain, leading to long-term complication. Also protect our economy. When we get answers to this study, it's going to help us to prevent the spread of COVID-19 more and help us protect the people living in Nairobi County. The methodology of this study: we will use a descriptive study design whereby questionnaires and interviews will be used to collect data. A systemic random sampling procedure will be used during questionnaire distribution and conducting the interviews. We will use a sample population of 1,240 respondents, calculated at a 90% confidence interval level. And computers and calculators will be used to analyze the data. Preliminary results from similar studies conducted by Starlick and Evelyn Carrijo in Kenya suggest that the responded distribution presentation will be 43% male and 57% female. Distribution presentation according to percentage of COVID-19 reduction will be: hand washing will be 43%, physical distancing will be 25%, and use of mask will reduce COVID-19 by 53%. Distribution presentation according to reduction of COVID-19 prevention: washing hands will be by 98.1%. Use of mask will be by 93.1%. Physical distancing will be 88%, and staying at home will reduce COVID-19 by 87.5%. As we've seen from the research of these studies, they have shown that these public health preventive measures can help us prevent COVID-19. Therefore, we should implement them so as to protect those people living in Nairobi County from this COVID-19 infection. Also, we found out that from their study, they show that these public health measures have a negative impact on people, because this study so as to understand the effectiveness of this COVID-19 their effectiveness so as to help protect the people living in Nairobi County and protect their economy. I recommend this study to be carried out in Nairobi County to help reduce the infection rate of COVID-19. As we all know, prevention is better than cure. Thank you.
Harun Shiundu.
Good afternoon, everybody.
Good afternoon.
Good afternoon. Wow. I hope your afternoon is amazing. And as a matter of time, I'll just be brief in my presentation, and I hope to be done in less than 5 minutes. We are here to talk about the content, basically. we are here to discuss about the content. I don't want to go into a lot of nitty-gritties. It will be just a waste of time, right? Okay. So basically, we all know the most common characteristics of different viruses that make them a menace in the medical field. And that characteristic is that they usually mutate, or in simple terms, you can say that they usually change in structure, right? And it is easy, basically, to explain that from a clinical point of view. But what about from a research point of view? How do we see it as researchers? Independent of the type of mutated strain, or as we are aware, the variant, we've had the Delta variant, the Omicron variant, we all know those. So independent of this type of strains of COVID-19, we note that the prevention measures have been the same all through. We've just been told we need to wear our masks, we need to maintain social distancing. As I can see, we are maintaining the social distance right now, and we need to observe our sanitation, things of the sort, and they are the same all down the line. But why is it that there is always a surge whenever there is a new variant in town? We need to understand why there is always a surge. So basically, it means that there is a problem somewhere. In our systems, maybe there is a problem, or at our community levels, there is a problem that needs to be addressed. And as researchers, it is within our jurisdiction to address those issues. So basically, this is why I decided to come up with this amazing poster, or as an amazing proposal. It was about the TIP approach. Sorry, the topic. The TIP approach to analyze COVID-19 prevention measures in Kenyan referral hospitals. And I decided to specifically pick the Kenyan referral hospitals because recently I was working on a certain study that was funded by Pfizer with the Ministry of Education Directorate of Research. And while we were visiting several hospitals within the country, to be precise, 12 hospitals, we noted that I was even wondering whether the policies that were enforced by the Ministry of Health and the public health sector, I was wondering whether they were actually enforced in our hospitals. There was a gap in these referral hospitals, and I decided to pick the referral hospitals. And the second reason as to why I decided to pick the referral hospitals is because they usually serve a lot of patients, and we are targeted, and our target here basically is the data. We want to ensure that the kind of data that we get is sufficient to steer our project. So when we talk about the TIP, we're talking about Transformative Innovation Policy. When I talk about innovation, I don't specifically refer to innovation as a technological innovation, but also non-technological innovation. Let's say, for instance, when you go to the communities, deep down in our communities, some awareness are usually passed on to other community members through the barazas, through radio talk shows. Those are innovations. Okay, those are innovations, so we need to understand that. So basically, TIP is basically a perspective that connects social and technical concepts and practices to ensure that there is transition. And I decided to use a specific type of approach here in order to ensure that we gather a lot of information. And on the objectives, we saw that we have several objectives that will help us steer this project forward. And when we proceed to the materials, we are going to use unstructured interviews, we are going to use questionnaires, and the reason why we're using these unstructured interviews is that we are learners, and whenever we encounter several questions, we don't want to set our minds specifically to various questions. We just want to be open-minded. So let's say when we visit Hospital A, and we get a set of information that will be essential and is not included in our set of questions that are in the interviews, we are going to include it. That's why we are focusing on the unstructured questionnaires. We have the focus group discussions whereby we are going to communicate with the community health volunteers and the key informants of the facilities. We have we have the questionnaires, we have the focus group discussion, and we have the first-hand observation. And in the methodology, this TIP approach basically, as I've said, we are going to basically use a qualitative type of research, and the tools that are usually entailed in the qualitative type of research are there, listed in the materials. And basically, as I've told you, we are going to engage with the key informants, which will definitely be a medical practitioner, and we are going to also engage with the community health volunteers, which will help us interact more with the community members in spreading this awareness. Then we have the TIP elements here, And this tool basically is just to guide us, obtain more data, and create a blog report. It is essential to have a blog report on every specific kind of element. Directionality, we just need to have specific set of approach that we are conducting our research. When you talk about the goal, is social challenge. Okay, thank you.
Michael Kipsoi, Raja Bambeza, Jared Orua, Nelly Asiachi, in that order. 5 minutes to commute, so you just give us in a nutshell.
Good afternoon.
Good afternoon.
Okay, my proposal topic is the effectiveness of the practice of hand washing hygiene among healthcare workers in the prevention of hospital-acquired infection. On the introduction part, following the lifting of the COVID-19 restriction, healthcare workers have become hesitant to practice hand washing, increasing. This leads to increasing of hospital-acquired infection. The propagation of hospital-acquired infection is estimated by reducing 15 to 30% with a good hand good hand hygiene. Sorry. In developing nation, the prevalence of healthcare association is 2 to 18% times higher. However, the few data, infection prevention and control, exploratory studies in Kenya. Okay, I'll jump to the objective. Our objective is to assess the healthcare workers' compliance with the hand hygiene and knowledge of standard hand washing practice. My second objective is to determine whether or not hand washing material are available in Nairobi Hospital. Then the last one is to show the importance of hand hygiene in prevention of hospital-acquired infection. On the methodology part, our study design is a retrospective review and analysis of hospital records for patients and healthcare workers who contracted hospital-acquired infection. Our study area is, the research will occur in 3 Nairobi County Hospital Maternity and Pediatric Ward, which is Mama Lucy, Kenyatta University Hospital, and Bagadi Hospital. Our study population is all mothers and children in maternity and pediatric wards of Mama Lucy, Kenyatta University Hospital, and Bagadi Hospital will be our study population. Our sample size determination, this led us to get 525 participants plus the missing data, which is 15%, which we can use 614 respondents. On the section of procedure for sampling, the sample size will be proportional to monthly admission due to the hospital-acquired infection, with the sample size being shared across the month, proportion, monthly admission. Results part, this is an example of virus aspect of our actual outcome might appear. What do you think are the reasons for poor hand washing compliance? I come to find out that most people lack the knowledge of guidelines and protocol, wearing gloves and gowns, lack of models among colleagues and the superiors, ignorance, poor access of hand washing facility, and unavailability of soap and water. Another one is hand washing agents cause irritation and dryness. On the discussion part, I will also discuss on how healthcare workers need to know about good handwashing practice and training session for healthcare workers and provide current updated knowledge on hospital associated infection and infection prevention ways. It will lead a healthcare association infection. Thank you.
Rajab, and then Jared Orua, Nelly Asiachi, Linda Joseph, Hussein Daoud, Valeria Pembe.
It was about the second wave of coronavirus. It was to determine the public attitudes. The main important things that I gained from the main data that I gained from this study was, you can zoom into the other side of the graphs. We can see that religious influence had a really big impact on whether people will decide to take part in clinical studies or not. We also noted that this data, we can see that from different research studies that have been done in Kibra sub-county, we know that we have issues such as reproductive health that are a challenge to most people in Kibra sub-county, but due to the knowledge that these people have, they were not so willing to take part in such studies. So this shows that as the public health fraternity, we need to do a lot of public education to these masses, so that when we want to conduct studies for these particular groups, it can be easy to get them to our studies. My main point for that you can get from a specific kind of people. Yeah. So I think that's all that I have to present to you today. I don't want to be muted.
Is on the effect of the ramification of COVID-19 on maternal clinic attendance, a case study of Kibra. That is in Nairobi County. So I'll just go straight to my presentation for the interest of time. So under the introduction, thank you. So maternal and infant mortality continues to be one of the biggest challenges of the health system in Kenya. Informal settlements in Kenya have been known to have higher rates of maternal mortality, and also receive maternity services of varied quality, as it was said by one of my colleagues, Njigi. Yes, so data assessing progress on key maternal health indicators within rural settlements are also often scarce due to high population in the informal settlements, for example, the slums. This study aims to add to the body of the knowledge by investigating the effect of the COVID-19 pandemic and the mitigation strategies on access to healthcare services in informal settlement, that is Kibra. So under my objectives, number one, my first objective is to examine the effect of COVID-19 on attendance of maternal health services. Another one is to discover other barriers that hindered maternal access services apart from the restriction implemented by the government. For example, during the COVID-19, government came up with a strategic mitigation strategy, for example, the banning of the social gathering. We have also the donning or the sipping of mask. We have dusk to dawn curfew. So all these mitigation strategies, I've seen they have really affected the rate at which women or the pregnant mothers were attending the ANC and the PNC. Also, even the institution, the high rate of maternal mortality rate due to identification or through identity of what we are calling COVID-19. So these are the results. The one, it shows the corona, the clinic attendance before the COVID, before the Ebola virus, the other one during the Ebola virus. That's why I have to entail the retrospective and the prospective studies. Discussion, based on the Ebola virus disease findings, ANC, that is antenatal care, institutional childbirth, and PNC were greatly affected
Good. My name is Nelly Asiachi, a fourth-year student pursuing biomedical science. So my project is on...
We want to hear you. Put your...
Okay. My project is on... My proposal or gave guidelines on how to curb the spread, and hand hygiene was part of it, either using sanitizer in most African countries, including Kenya. So...
Hospital, which is actually one of the biggest hospitals in the country, which actually houses a number of patients who are actually suffering from COVID-19 disease. So from my study, I was able to interview a number of health workers and actually administer a questionnaire based on the study. On this study, the rationale of this study is actually based on the ratio of health workers to the patients. In Kenya, one doctor is actually projected to see 7,200 patients, which is actually below the requirement of the WHO, which stands at one doctor to 1,000 patients. So, based from this study, I was actually able to clarify on the effects of carbon dioxide, also on the effects of other diseases such as Streptococcus pneumoniae, which actually is associated with pneumonia, which increases in the levels of carbon dioxide retention. And on that part, we also have Streptococcus pyogenes, which actually also increases on the buildup of carbon dioxide. And you know very well that pyogenes, Streptococcus pyogenes, is actually also a key factor in the development of fever in the body. So what happens is that when this carbon dioxide retention increases in the body, the level of Streptococcus pyogenes also increases in the body, and this actually brings out somebody manifesting fever. And most of the times you can also see most of those people who suffer from carbon dioxide retention due to that effect also had an issue to do with Streptococcus pyogen infection. Another factor that I also looked into was what is called encephalopathic hypocapnia, which is actually based on the low intake of oxygen in the brain. And this causes increase in the intake of blood into the brain. And this is what causes what is called intracranial pressure. And intracranial pressure is actually associated with headache. So most of the times you realize that's why when people wear a mask for several hours, they also have mild headaches. And this is actually caused by the intracranial pressure. And another factor that I also looked into is actually on the mothers who are pregnant or expectant mothers who are actually health workers. Because in Kenya, you see the ratio is one doctor to 7,200 patients. That is actually a value that is way below the expectation of WHO. So what happens is that this expectant doctor will have to overwork herself so that she can meet the needs of the patients. So by doing that, most of the times she will be wearing mask for a longer period of times without exchanging the mask with a newer mask. So what happens? There is more retention of carbon dioxide, she's pregnant, and the hemoglobin of the fetus has a higher affinity to oxygen as compared to that of the mother. So when there's actually intake of more oxygen by the hemoglobin or the blood of the fetus as compared to the mother, then the mother will actually have more problems because there's low intake of oxygen, and there's the developing child is also taking more of the oxygen, and so that one can also bring a lot of problem on the fetus. Basically, I can also talk of, it also has something to do with hormonal imbalance, because look at how the air moves from the nose all the way to the alveoli. Let me just finish this. What happens, just 1 minute, please. Just, okay, thank you. Just what happens is that through the nose, we have what we call the contacting zones. And the contacting zones, we have what is called the AC2 type, the AC type 2 cells, which is called angiotensin converting cells, which is actually present also in the alveoli of the human being. That is actually a hormone that is actually very, very key in checking on the pH of the blood, or the potential hydrogen of the blood. So when you interfere with the level of the angiotensin converting type 2 cells or hormones, then you realize that you actually interfere with the pH of the blood. And when you interfere with the pH of the blood, the immune system is actually interfered with. And that one, you become more susceptible to infection or the virulence of the COVID-19 disease. Thank you.
Thank you. Is Geraldine here? Okay, if Geraldine is not here, Easter, and then Felicity, and then Calvin. And then we are finished. Catherine tutamaliza. Easter.
Good afternoon. Oh, yeah. Hi, everyone. Good afternoon. All protocols observed. My name is Easter Wega. Please bear with us for the remaining few minutes. Yeah, the Bible says the last shall be the first, so bear with us. Well, I will not dwell too much on the COVID-19 and explaining what COVID-19 is. It has been said over and over and over again. You know, COVID-19 is a virus. It affects the pulmonary system and the whole sort of round and round and round of it. So I'll just go straight to my point, if you can see. What are my study objectives? My topic is the influence of public view on the use of PPEs in mitigating COVID-19 transmission in Nairobi County. As earlier seen in the first preliminary stages of the COVID-19 infection, the rate of PPE wearing, as long as there was PPE and personal preventive measures in place, the rates of COVID-19 infection dropped. That was clearly seen. Now, why don't we wear PPEs nowadays? From here, I can see a number of us are not wearing our masks, or are wearing them in the incorrect way. Why are we not wearing our masks? What makes us not hand wash properly? What are these views that influence our personal, views on not wearing PPEs? And my study objectives were to assess the public view on the use of PPEs on prevention of COVID-19 infection, to assess the number of people using PPEs in Nairobi County, and to determine the types of PPEs you're currently using. From here, I can see masks, there were time gloves were used, gowns were used by multiple people, and that is part of everything else. My justification, why would I want a sponsor to sponsor my poster and to sponsor me to do this publication over and over again? COVID-19 is a rapidly mutating virus, and it multiplies as fast as it mutates. So why do we need to get this poster, this project ongoing and on the road? The ability to mutate makes it resistant to a lot of drugs. That's why there are vaccines that don't work. People say they don't work. There's no specific drug for the COVID-19 virus. And this is a reason for my poster. Epidemiological studies show that, the rate of mutation is equal to the rate of mutation and the susceptibility of drugs. My methodologies, I want to carry out this this presentation, this whole objective over here, I want to carry out in 3 sub-counties of Nairobi. This is Kamukunji, Starehe, and Makadara, and I will use a couple of measures, a couple of data collection activities such as questionnaires and focus group discussions on a set population of a number of people to carry out this test and get the exact reason why they don't wear PPEs and why they are so reluctant on washing their hands and not taking vaccines and not setting out the correct, social distancing rules. And as you can see on my poster, these are just results from a specific study that was carried out in the Kisumu County. 1 minute. Okay. These were results that were carried out in a specific county in Kisumu, and they can show you, if you look closely, the number of people wearing masks or just carrying out masks and not wearing them correctly are higher than the number that are actually carrying them. So I want to know why people are not wearing their masks and why they're not wearing them in the correct way. By the time this study was being carried out, Kisumu had a 75.9 prevalence of COVID-19, and this is really sad, especially in a place where multiple people just converge in one place. The Lake Basin region is actually a large space, but there are so many people in one position, and this makes it really hard for them to actually get help. So my recommendation was a repeat study of the exact same caliber to be done in Nairobi in these specific sub-counties. And once we do this study in these sub-counties, we will be able to reduce the prevalence of COVID-19 in these sub-counties from a... So yes, this is basically my study, and I would like to see it through. And thank you for your time, and have a lovely afternoon. My name is Esther.
Felicity Mogaka, and then finally Calvin.
Good afternoon. My name is Felicity Mogaka, and I'm presenting on concentration of fluoride in different brands of toothpaste used to prevent tooth decay in Kenya. So before I start, I would like to say that dental caries is a disease caused over time by the interaction of disease-causing bacteria or rot-causing bacteria in the mouth and fermentable carbohydrates. So dental caries is one of the diseases that that affect a lot of people globally, and a study carried out in 2017 for Global Health Load Survey was showing that about 3.5 billion people over the world are affected with dental caries, and especially in the developing countries. This is because the fluoride mineral component is not consistent with that declared by the manufacturers in most companies. So fluoride is a naturally occurring mineral, which is fluoride is a naturally occurring mineral that is added to toothpaste and other. Okay, I'm so sorry. Yeah, so fluoride is a naturally occurring mineral that is added in water in varying amounts and also in toothpaste to prevent tooth decay. And the studies have shown that the most effective way of using fluoride or preventing tooth decay is by adding it in toothpaste. So this study, my objectives were to determine the total fluoride concentration in different brands of toothpaste sold in Kenya, to determine the free fluoride component in different brands of toothpaste, and to determine the abrasives that are used in the toothpaste. So the reason why it is important to know the total fluoride concentration in different brands is because the recommended concentration of fluoride is 1,000 parts per million to 1,500 parts per million for adults, and in children the required amount is 1,000 parts per million. However, in most brands in Kenya, they contain 1,440 parts per million and 1,000 according to the samples that are used in this study. But in as much as that is the recommended amount, most companies don't put the required amount of fluoride in toothpaste. So my objective was to determine the total fluoride so as to know whether it is in consistency with that one which is required by the WHO, and also to determine the free fluoride, because that free fluoride component is the one which is going to help protect the tooth from getting dental caries. Yes. And also to determine the abrasives that are used in each toothpaste. So the method that I used laboratory analysis, and I used 12 different samples of toothpaste, and I used an ion electrode, specific electrode, a fluoride specific ion electrode to determine the concentration, and a linear regression curve was used to determine the amount in parts per million. And so in those brands, we have different, in the results section, I coded them with different letters, A to J, and the amounts of fluoride in parts per million were determined. So the results were that none of the toothpastes had the fluoride required, they had the fluoride that was inconsistent with that one declared by the manufacturer, and also some of them, like letter E, had as low as 42 parts per million, which are not caries effective, and the one that was declared was 1,000 parts per million. So this could be one of the reasons why there's an increase in the burden of oral cavities or dental caries in these parts of the world, because most companies are not regulated, and they don't follow the manufacturers. They don't follow the recommended fluoride level in the toothpaste that is recommended by the WHO. And so in conclusion, I also determined the abrasives used, because the abrasives that are commonly used are calcium carbonate and silica here in Kenya, because the abrasives are the ones which are used to cause the teeth to become white. And so if the abrasives are not regulated, the amount of abrasive is too much in toothpaste, it's going to cause the enamel to erode, and over time there's going to be caries. And so here in Kenya, they don't indicate the amount of abrasives used, which is very important to be considered. So my recommendation would be that in future, the quality control companies should ensure that only the required amount of fluoride is added in toothpaste, and also to check the level of the abrasive use, because if there's too much abrasive used in toothpaste, it's going to cause what do I call it? It's going to cause an effect. So someone would be brushing and thinking they're going to protect their teeth from cavities, but instead of preventing tooth decay, they are going to have it even after using it. Yeah, so that's it. Thank you.
Finally, Calvin.
Hello everyone. Hello. Yes, my name is Calvin Nyamira, and I'm here to represent my topic of research, which was the factors that are promoting malaria in Mawawa ward, where I come from. So malaria is basically a life-threatening disease that is caused by Plasmodium parasite, and it's transmitted through bites of infected mosquitoes, female Anopheles mosquitoes. So there were a few empirical studies that directly examined the relationship between the factors promoting malaria and adverse effects that accompany the disease in Mawawa ward, where I come from. So the aims were to assess the potential of insecticide-treated nets as vector control strategy for capping malaria in Mawawa, to determine the effectiveness of the indoor residue spray in controlling the spread of malaria, and to scrutinize the effects of malaria on the livelihood of the Mawawa ward residents. On methods, simple random probability sampling procedure was used as well as the purposive non-probability sampling procedure. The study used self-administered questionnaire, document analysis, observation, checklists, and checklists. Quantitative and qualitative methods were used to analyze the data with both inferential and descriptive analysis being employed. And those were my results that I used to develop those graphs. I will rush to the discussion part of it. I think you can see the graphs there. So from the study, it was noted that 53% of the entire population slept under treated mosquito nets. The rest of the population, that's 47%, did not. So therefore, they were at risk or they were exposed to mosquito bites. Insecticide-treated nets, bed nets, has been seen to be highly effective in reducing malaria. That's when you look at the results, according to the graphs there. And then low education level of the head of the households was one of the reasons why there was such high percentage, that's 41% of the population owned the nets. So you realize that still there were people who didn't have the information that there was need for them to sleep under the nets, and those nets, there was need for them to be treated with insecticides. So the study also proved that malaria disease had various impacts, both socially and economically. So my conclusion was, or the conclusion from the study was, most residents did not use IRS. Sorry, let me. So it was found that only half of the residents slept under insecticide-treated nets, and most of the residents did not use IRS, that's indoor residue spray. Gender, age, occupation greatly affected the vector control strategy. So therefore my recommendation is that as much as the government, and both government and non-governmental organizations have really tried to fight the disease, still we have cases of malaria being reported in various parts of the country, in this case back at home. So I'm requesting that we, in future, we can join the forces and go back and educate our people on these measures, and I think it will help a lot. Thank you for your time.
Can we stand up, please? As you clap, keep clapping. Thank you very much. Those claps will not earn you lunch. Clap again, better. Thank you, thank you, thank you very much. Please take your seats. We appreciate everyone and all of you who have been very patient in terms of listening to your colleagues' presentations, but also keenly following and doing your own presentations. My 2-3 minutes submitter, he left. The good language has continued. Great confidence. You are men and women whom I feel comfortable to accompany me to conferences locally and internationally because you have proved it. I'm very, very happy. There is a, should I say quote unquote misconception, but don't say it beyond here, that only students in the School of Law put on suits and dress smartly. I think that myth has been demystified today because you guys just dressed very, very well. I don't know that you dress like that every day or only today, but whatever the case, you are good. I've seen suits. I think some have been from the dry cleaners. You did well. But probably you are copying from your dean because she's always smart. So those are compliments. I'm very, very proud of you. Then listening to you again, I have had some very interesting topics and some have pricked my conscience. You see, conscience goes beyond academia. So they have pricked my conscience. There was a topic about waste tire management. I replaced my tires. There's a time I decided I want to replace all the 4 so that I don't have to go back to the shop. So when she was presenting, I was like, okay, so how were they disposed? So those are things that touch us as well. I had a topic of immunological perspective. I was like, hello. And after I had that, one of my colleagues, and I really want to read the comment, one of my colleagues, he's a PhD holder, but I'll not say the name. So he writes, Sister Prof, I can't believe that our undergraduate students could have such presentations. There is hope for research in Africa. It's truly accurate that it had to be #1 priority. Research is #1 priority in the strategic plan. I thought you'd clap for yourselves. Undergraduate students. And I want to add, as Director of Research and Graduate Studies, that I'd like to take the challenge that was given to the school, that probably we should have a symposium like this, but for all undergraduate students, and we send out a call, and then we come and sit and see who has what to present. Probably we might get the best papers that we can present locally, internationally, and come up with the policies that can be able to change our lives. So you have set the pace, and we congratulate you. But there was one that I think this student, I don't know that you know me, you are targeting me. So we shall sort it out with your dean. There was one who made a recommendation of taking care of COVID-19 as having enough sleep. So that one for enough sleep. We were discussing with Dr. B yesterday. She was asking me, how much do you sleep enough? Asking the visit, do you sleep enough? So I'm like, have you been snooping? Are we sleeping enough? But it's a good recommendation. That's on a light note. So we should do this again for the entire undergraduate students, as we have said, but let it not end here. I know Dr. B is going to give overall comments, but would like your studies, your researchers to go beyond having found out that. Therefore, and would like some of these proposals to come to our desk to request for funding, so that you conclude the studies that you have started. Nobody wants research money. Yeah, there are some studies there, depending on how Dr. B is going to talk about them. There's 1, 2, 3, 4, 5 that would like to see you go to the next level. And that should be able to support us. Finally, you talked about research licenses. A number of you mentioned NACOSTI, a few mentioned ethical clearances. We want our students to get used to obtaining ethical research clearance before conducting the studies. All the studies we are presenting here should have gone through the ethical clearance process to protect you as the researcher and also the research subjects. Because some of the findings you are presenting, if you are to go to another level of either challenging the policies or making recommendations that could better people's life, or if anything happened to you in the field, then the first question would be, did you get ethical clearance? So I know the Daystar University Ethical Review Board has lowered the amount of money for undergraduate students to conduct research. You can save from your French fries and sausages and just pay 500 shillings and have your research go through the right path. Otherwise, we are super proud of you, and once again, you have set the pace, and I congratulate your Dean, Professor Martha Kiarie, the Dean of School of Science, Engineering, and Health. I thought you'd clap for your Dean for doing such a wonderful job. And of course, to Dr. Opio. I saw most of the students, your supervisor is Dr. Opio, so we congratulate her, and also for putting all this together. Now, without much ado, I'd like to present to us the reviewer, the professor who is going to give comments. Mine was to set the pace and then to invite her. So she's going to give us what she has learned, what she has seen, recommendations, way forward, overall overview. And I'd like to once again welcome Professor Dr. B, as we call her. She's the director of the Global Health Initiative at Howard University. Keep clapping until she gets here. She has come all the way and has been patiently sitting to listen to you. Thank you. So after Dr. B, the acting Vice Chancellor, Professor Martha Kiarie, will come, and then eventually Dr. Opio will tell us what next after here. Dr. B, karibu.
Thank you, but I'm going to make one correction. I know you have Howard University students here, and they are our neighbors, and we love the Howard University campus, but we're at the university.
No, I'll correct it myself. From the University of Maryland. Sorry, yes, University of Maryland. Yeah.
Thanks. So congratulations. Doing research is a challenge, and learning the different steps in doing research is part of your education. But you guys are starting and presented. Something that I saw that was consistent was passion. I saw that you were interested in your topics. You were interested in the different populations you were looking at, and you were tying together the topics and the needs and the justifications for doing research. So I want you to take that passion and use it and go forward to try to do some of these studies, to actually work on investigating these different questions, topics, populations, to do things that will be worthwhile and applied in the future. Think about the contributions that could be made from students at Daystar University if you actually conducted all of these studies. You would be well on your way to improving the health of your entire country. So I want you to take great pride in the idea that you have passion to do worthwhile projects that will make an impact on the health of your nation. So that's the first and foremost thing that I want to raise, is to hold on to that passion. Doing research can be hard. There are many steps involved in doing research. And to have the energy and the excitement to take through all of those different steps, some of the studies you were presenting could take years. And not only to go through the process of developing your methodology, your procedures, gaining clearance through NACOSTI, through Daystar, IRB, months. This could take months. So hold on to that passion and understand the value of it. I do have quite a few comments, and my own students will know that I'm ruthless. I will write all over your papers, and at one point I do want to give you feedback individually. So I have written all of different pieces of these studies. So we'll spend something like 4 weeks looking at literature reviews and giving sources and giving information. A criticism that I saw across the background sections was you lacked detail. It's not enough to say that smoking is a major health concern. We all know that smoking is a major health concern. But give the prevalence of smoking rates. Talk about what is the severity of disease associated with smoking. The other thing in doing your literature reviews is practically every one of these studies in some way has been done before in other communities. Know your background research. Know that something that has been done in the slums of in Mumbai could be applicable to the slums of Kibera. So look through that research and know that people have done similar types of studies. What you're doing with your study is you're adding to the literature, which brings me to my next criticism or recommendation. Many of you are trying to do too much in your studies. You list 4 objectives that could be a lifetime of research. When you do research, you're adding small contributions to the literature. Please, you're going to, if you try to take on too much, the likelihood of you doing all of that is really small. So if you're going to do a study of bed net use, that's fine. But look at maybe one small part of the population. Look at the use of treated bed nets versus non-treated bed nets among households in a certain economic level. Just take on a small bit of it. Don't try to do so much that you're never going to be able to finish. The next thing that I want to talk about is, okay, so I'm telling you to take on smaller amounts. But what I want you to do when you do smaller objectives is to go more in depth. Something that I didn't see in a lot of the proposals was a really clear definition of what your outcome variable was. So be very specific. If you're going to look at a dependent variable, what is it? And then maybe list 4 or 5 independent variables or predictors that you think are important. And lay out that you want to look at that relationship. If you try to do everything, you're not going to do anything. The next thing I want you to do is your formatting. I know you can do better. When you do a poster, there is no reason to be repetitive. You want to say something once, and that's enough. In a lot of your posters, you're very wordy, and you don't need to be. And by the way, when you're wordy, a lot of you, oh, I'm being really negative, aren't I? Oh, I'm so sorry. Well, your other professors have praised you greatly. I'm here to give the criticism. Passive voice. Avoid passive voice. Be direct and be active in what will your researcher do. Avoid the situation of data will be collected. Instead, a researcher will collect data. It's not just going to be a passive process, it's going to be an active process. When you do your poster, make sure when you present your tables that they're worthwhile. When you present your figures, they're worthwhile. Never put a figure that can be captured in just 4 or 5 words. Make your figures worthwhile. Many of you presented univariate statistics in your figures. Why? You push yourselves. Think about bivariate relationships. Several of you showed an entire pie chart to show the presentation of males versus females. That's something you could just do in 4 sentences. You can say 50%, 55% were female. And by the way, if you say 55% were female, you probably know that 45% were male. Think about your posters as every single pixel in that poster costs money. So make every single pixel count. And lastly, my big recommendation is anticipate the question why. When you anticipate the question why, you're going to be explaining things in your poster of why are you using this sample? Why are you going to this county? Why are you using this instrument? Anticipate that those are going to be the questions that a reader will want to know. So when you present your data in your poster, explain, anticipate that someone's going to say, why did you select that sample? And justify it right there in your poster. Okay, I've been negative. I tend to be negative. But I don't mean to be. What I'm trying to do is push you because I see great potential. I see great potential in these posters and these research studies. And I think if you pursue these studies, you're going to put Daystar on the map for doing great research. So I will encourage you to move forward. I'm going to give you one last piece of advice. And my own graduate student will laugh about this because when you're a PhD student, they do this terrible thing to you where they make you take comprehensive exams. In our university, they basically give you an exam where they say, write a research proposal. And the poor student has to go, they've got 2 weeks to write a full research proposal, and under the conditions that they talk to no one, that they don't seek out help, and they do it all independently. And Sasha, you should know that I'm fighting against this, because I think it's the most ridiculous exam out there. Because never, ever will you do research by yourself. So, one last piece of advice is maybe make some cohorts here. You have some people who are interested in COVID attitudes about mask wearing. You have some people who are interested in malaria. You have some people who are interested in maternal mortality. Gather together and work together. Share your instruments. Share your background information. Never, ever try to do research by yourself. Use each other's knowledge and strengths to improve your research studies together. So those are my pieces of advice. I'm going to be around, and I will be also always available to all of you via email. And Dr. Landa will attest to the fact that I will respond, and the only time that I might not be responding is if I'm on an airplane on a 13-hour flight and I don't have internet. Then I'm not responding. But try again, because I will answer your questions, or at least send you along to someone I know who is an expert in the field that you're studying. So let's continue to work together. Let's continue to pursue these research topics, again, for not only the strength of your university, but for the strength of your country. Thank you.
Thank you very much, Dr. B. I want one courageous young man to come here to lead us in the clapping. Meanwhile, is there any question or any comment from the students that you'd like to give Dr. B before she sits? Yeah, there's one. Please come here. Oh, the email. Okay, I will. I'll give one, and your dean or Dr. Pio will send to all of you. Okay, fine. Only official matters concerning the research, please. Great. Where's the young man to come here next to me and lead us in the round of clapping? Any other question or comment? Appreciate the young man. You know, these chances. We always don't have Dr. B from the University of Maryland, so it's a privilege to be close and lead us in this. Please.
Thank you. Thank you. We are going to clap the 3 factorial clap. Okay, so we go 1, 2, 3, 1, 2, 3, 1, 2, 1. Right? That's my combination. You know, you can create yours. So 1, 2, 3, 1, 2, 3. Again, 1. Yes. Thank you.
Thank you very much. And clap for him as he goes back. Well done. Yeah. So now when the Vice Chancellor left, he said that he left his title to your dean. And so for this moment, she's going to be our acting Vice Chancellor. And so Prof, kindly come and give your remarks. Let's appreciate her. Thank you. And
we can promise ourselves everything. So, are you happy that you came? Who is not happy that they came for this presentation? I've received comments from people who probably just heard or they are passing by and they were asking, do we have a graduate school? Yes, we do, by faith. So thank you very much. I really want to appreciate the organizers of this event, starting from the Director, Research and Graduate Studies Directorate, Sister Professor Lando. Forgive me, today I've been calling you interesting. Yes, so thank you very much for, I remember the day you sent me that email. What is the name of that faculty who got awarded for the best. You remember? And I said, this is Dr. Monica Pio, and you said, send me her telephone number and email. And from that moment, I can see where it has all been. Let's appreciate Dr. Pio. Yes. It would be very unfortunate if I, as a dean, would probably be appreciating Dr. Pio in a different setting. You know, we always sing people's praise when they have gone. But Dr. Pio has been very, very instrumental in our school. And so when we got these emails that were saying, who would you nominate for the best faculty in your school? Of course, I could not nominate myself. It is illegal. So I looked around, and I can tell you I did not take 10 minutes to respond to that email, because I know all the people that teach in the School of Science, the amount of efforts that go into this. Dr. Pio has been holding the department, or let me call it the section of biomedical studies, almost on her own. So I know we teach. I know that because I too teach in that, and I've seen some of my students doing very well here. But I know when it comes to that relationship of one-on-one, she has done it for each one of you. And she, whenever I talk with her, if you don't know, she knows you by your names, by your strengths, by what you smoke, and what you drink. Yes, by what you drink, what affects you, how your GPA will move from 3.2 to 2.2. And she will even tell me, I noticed when that student started doing A, B, C, D. And fortunately for you, she also will do it to you personally. So we really want to appreciate the efforts of Dr. Pio, not just for this particular event, but across her interaction with our students. We can say it has been excellent. Thank you, Monica, Doctor, for putting all this effort. It's never in vain. We may not pay you, but when the payment starts to come, you may have to move to a new house because of the blessings that will come. Yes, when these young men start occupying all these research station offices like they have started, remember when they begin calling us from all these places, from now at the Ministry of Education, the scientific side. And she's very annoyed with Daystar. He wrote to me about 2 days ago, and he said, I don't like the way Daystar does not respond to emails sent from the Ministry of Education. Can you imagine? My own students, and I'm Somea, that you people be replying. And I had to say, my apologies, sir. That is actually done by a different office. I called my own student, sir. Yes. He's a senior officer in the Ministry of Education, heading a research division nationally. Wouldn't you be proud and just remind him, sir? Yes. If you want to know him, see me here. And he also attended our focus, our forum, where we were discussing the Masters in Public Health, because he wants to do a Masters in Daystar, because Daystar made him a strong man. So I'm very proud of each one of you. And like I always tell you when I'm teaching you, you can see now, it's not pride when I tell you, go and read this paper of mine online. The reason why I ask you to read is because you should be proud of the work that you have done. And I've always told some of you, it will be very bad if you get out of school and you don't have a paper published online. And I am so proud that some of you, most of you, we've had about 30 or more presentations here. You can imagine that's a whole graduate class. So the minute we have the accreditation, all 30 of you should come back to class, and we can now do this research, even at a higher level. So on the issues of ethical clearance, I know these are issues we have talked about even in class, and Professor Lando, these people, I always tell them, don't try to do it I'm a member of that ethical board. I always brag with that one. I'm a member of that ethical board, and I want you to do ethical research. So I'm sure, how many of us went for an acoustic clearance when we were doing our research? Raise up your hand. Yes. So I'm not accusing you. You don't go for an acoustic before you pass through our ERB. Yeah, I know they've been giving you clearance. But now the requirement is you must come through the Institutional Ethics Review Board. Please do that. Do that. I know there was a year they all got cleared for research. So we are saying, let's do it the right way. The director, the chair of the board herself is here today. And I'm sure she will be looking at what we are doing. And I can promise you we will do it rightly. So the other thing is we've been given very, very useful advice by Professor B, understanding what is it you really want to do. What is it you want to do? I know some of the stuff we've done in class. For example, the insecticide-treated mosquito nets. The way it works on an old man is very different from the way it works on a child. And that's why data will always be 0 to 5 years, then from there to teenage, and then the older people. And of course, really you get to understand what you want to do, be very projected, and understand exactly what it is you want to do. I was very excited as I listened to some of these immunological aspects. Jeremiah Marwa, I could see you've been to my class, and that was exciting. And when you hear those terms being used here, very, very exciting. So the other thing is Sister Professor Lando always puts us on call, where her directorate will say they have this amount of funding for research. And if I'm not sure, the funding for this year, the call for this year has not gone out. So it must be somewhere being written and signed. So when it comes out, please be among those who will be putting in their proposals for funding. Yes, we need to sit down, and I've seen each of those research proposals have there is a supervisor. You can also get a second supervisor, somebody in the area exactly that you're working on, sharpen the proposal and go for funding. I know I've gotten funding from that directorate with other students for research, so it is possible. So the other thing I want to do here is appreciate the response that was given by the chief guest. Rarely do you find, when she said she has read all these 30 posters and she has comments for each one of you, I wondered. I got a WhatsApp message at midnight. We have arrived in the river from the airport. So was she working on the plane? Did she go to bed on arrival? And okay. So let's appreciate those, that feedback. Yes. When you get your feedback, and this I'm talking about this as one who, by coincidence, experienced what you have experienced today. When I was third year, we were not going to fourth year ourselves. And I was doing a presentation, and if you go online, you can read that paper that I worked on that time, on the factors that influence the choice of food in the desert locust. Desert locust is a pest. That paper, which is online, I wrote that when I was a third year undergraduate student. And when as I sat with in a group like this, and we were doing our presentation, and I got my feedback, as I sat there, I remembered that day, and I said, how lucky are these students that somebody has come all the way? Can you imagine? Can you approximate the kilometers just to tell you are doing well? So if that doesn't drive your passion higher, I really wonder what they need, Dr. Pio. How many of us feel encouraged? Yeah. Raise up your hand higher. Because you have not even received the comments. And yeah. How many of us even felt nice when the VC said he's proud of you? Yeah, so when you sit on the hill and you do your research, people are appreciating you. So when you get your poster, don't crumple it up and keep it. If I was the one, and my vision and my dream is to join the scholarly world, I would flame, if not put that poster in a way I can store it. As a reminder of where it all started. I know you have written reports. We have them we have examined them. We have given you grades. But this one has been done specifically. So don't throw it away. Let it be a reminder to you that I actually stood in a plenary and I presented a paper from my research. And whenever you remember that, you will have a reason to work hard. So I really want to appreciate you, appreciate your coordinator, Dr. Pio, the HOD, Dr. Kinodia, who is not here, and the other members of faculty. I saw a lot of research methodology being, I kept wondering. There's one where there was going to be both retrogressive and progressive. And I said, that one must take 20 years. Remember the example I always give you in class. If you want to do a research and you choose the elephant to be your research animal, and you need to go to the 3 generation. When we ask ourselves in class, why do we use bacteria? And then I tell you, think of using an elephant. It's big. You can make the observation very easily, isn't it? But you have to wait for how many years? Assume the elephant gets pregnant today. How many months? 24. Then that young elephant, to give you the 2nd generation, will you still be in the lab waiting? That is what I remembered when I had this progressive, and retrogressive. In public health, normally we survive by going retrogressive because we can go and find out where you started smoking, whether it was on the rocks, on top of the ICT building, or behind the headmaster's office in your high school. We can always know. By that, I mean the time, not the place. So thank you very much. I can see we need to stop it there, and we can continue. We take the challenge of having a symposium. We will organize it. I know when Professor Lando says it will happen, I can assure you it will happen. Yes. Yes. So, thank you very much. So, in Africa, we always say one hand attracts the other. Yeah. So, karibu. Karibu, Professor B. Yes, yes. Probably you know much about DASTA from what Professor Lando has been telling you. We want to give you something that will remind you of DASTA every other day. And it's a beautiful bag.
You need to fix it. First letter is D.
D.
See, I could have let that go. I did it.
There's a B.
So BORZEKO@umd.edu.
Okay, so let's get this one well. There's a microphone.
This part of the world, we let me not go to that direction, but let me just say that Dr. B didn't come alone. Like we said, we talked about mentorship, and we talked about tagging our students along, isn't it? Yes. So can we ask the team, the three who accompanied Dr. B, to come to the podium so that you also the students have an opportunity to see you from the first. You've looked at all of them from the first, but they haven't. So please come here, the three of you, and have a moment also with the acting Vice Chancellor before she ceases to be.
I wanted 3 more minutes.
So, yeah. Yeah. So Sasha here, Professor Kiarie, is a PhD student. She has come to collect her data from here. And so I would like you to welcome her and give her a small gift. She's going to stay around for some time.
Yes. So welcome to Daystar. I know we chatted about your research, very interesting. And among these students, you can also have people we call cracks. They can help you work on your data. Among a number of them have worked with me, and they are very good. Yes. So you see, I'm still buying you some time, eh? So this is for you.
Thank you so much.
So let's have a photo. You hold it nicely. Yes. So that when you go home, you tell us we went to stuff. Yes. Thank you very much.
Then we say, normally we say behind every successful man there is a what?
A woman. But now
There is a what?
a woman.
Behind every successful